there, it's Dr. Miller from Liberty Pet Hospital. Today we're going to talk about joint health in your dogs and cats. It's very important when they're young and growing that they are lean. Many of us have lost sight of what an ideal body weight looks like for a dog or cat, and we have handouts, we have things we can discuss with you to show you what an ideal body weight looks like. And we want to really aim for that when they're young and growing. Their growth plates are open, which helps them grow. And if they are overweight as kittens and puppies, that's not healthy for their growth plates. We know there can be more orthopedic problems with dogs if they're overweight as youngsters and adolescents. So we want them lean as youngsters. We can discuss that with you as we examine your pet for a lean body mass, discuss feeding. I prefer that they're fed meals. That way you can measure exactly how much they're eating. This is extremely important in cats so they don't end up overweight. If we can prevent it and keep them lean throughout their life, we're in a much better shape than if we're trying to play catch up or get them to lose weight. For adult dogs that have already shown some signs of joint disease, or even adult cats, many older cats over the age of 8, 75% will have some joint discomfort or joint arthritis, and in many times with cats we'll see them pooping or peeing outside the box because it's just too uncomfortable to go up the stairs or down the stairs or posture to poop or pee, just like it might be for an older family member to get in and out of the bathtub. So making sure that they're lean as they're growing and as adults is important. But once they're overweight, we've got to work on weight loss. And for some of those cats and dogs that have arthritis, we can get the weight off, but the arthritis is still going to be there. We do have prescription diets the doctor can talk to you about. I can go over it with you when I see your animal. Our boxer has done exceptionally well on a Purina prescription diet called JM. It has omega-3 fatty acids and glucosamine and chondroitin added to the food, and he is running and playing and limping less and standing more equally instead of off to the side to put more weight on his right hind leg than his left. I'm really impressed with how well he's doing on that product, but again, we have to talk to you to decide what's best for your pet. There's also glucosamine and chondroitin supplements that they can take daily. Usually there's a loading dose, meaning they take a higher amount, dog or cat, for the first 30 to 60 days and then decrease after that. We carry Daysequin Advance. It's a great veterinary product that can help with their joints, and it's really important to buy the veterinary products because, like Nutramax, who makes Daysequin Advanced, they do outside testing to prove the amount of glucosamine and chondroitin, green lip mussel, and curcumin are actually in the product, because nutraceuticals are not evaluated by the FDA like your antibiotics or seizure medication. There's nobody really making sure that the amount of glucosamine and chondroitin is in the product. So you might be buying something over the counter that truly has that amount in it, or it may not at all. So I really encourage you to buy the veterinary products from your veterinarian, so that you're sure you're getting what you're paying for. Omega-3 fish oils can help with joint inflammation. We have a pump that you can put on your food. Prescription diets will also have that in there too if it's for joint health. So that can be very helpful. There are also pain medications that can be given. A lot of kitties feel better on gabapentin, same with dogs. We can sometimes use tramadol. One of the bigger helps is anti-inflammatories like Rimadyl or Carprofen. There are other NSAIDs as well. We do need to check blood work, usually initially and 30 days later, to make sure that we aren't seeing any signs of toxicity or blood cell changes on the dog's blood work. Cats, we can't give NSAIDs too long term. That we mostly get them to benefit from fish oils, joint supplements, weight loss. Those are, and gabapentin for pain. But I think the most important thing is a lean body weight. We had a Great Dane that almost lived till 12, and she had bilateral hip dysplasia, so both of her hips were slightly dysplastic. And I feel one of the main reasons why she lived as long as she did is because she was lean. She looked like a gazelle or an antelope. She was very, very nice and thin. She wasn't underweight. You could see her waistline. She had a nice tuck right at her side, but she did not have a lot of fat covering her ribs. She did not have parallel lines when you look down at her waist from above. Her waist kind of hourglassed in. She wasn't parallel or kind of bulging out and heavy. We know that from studies that different prescription pet food companies have done that dogs and cats that are overweight or obese live on average 2 to 3 years less. And I feel very confident that Secret would not have been with us as long as she had if she was overweight or obese. Also, all of your medications are calculated on body weight, so you're paying more for medication your pet may not need. If it were an ideal body weight, they might need less, so it saves your pocket and saves your pet from needing more medication. Same with our boxer. He has arthritis in both of his knees. He hasn't needed surgery, but I keep him very nice and lean. He's got a nice hourglass tuck. He's on the prescription joint formula. He's doing much better. So there's fish oils and glucosamine and chondroitin in that. He does take an anti-inflammatory every day, and he gets his blood work checked every 6 months. But I really believe that leanness is so important. So if you need help with that, please give us a call and we can get you scheduled. For your kitties, make sure they're lean, make sure you're measuring their food out. We can help you with weight loss and some enrichment to try and get them moving, but we don't want to see them having trouble getting in and out of the litter box or getting around your home. So I hope you found this informative. If you have any other questions, please give me a call, schedule an appointment. We'd love to see you. Okay, bye.